Are you still a little concerned or a little confused about what the 2019 outpatient prospective payment systems proposed rule means for evaluation and management? Well, stay tuned, because in this video, I will tell you a little bit or give you more information about the proposal. And don't forget to stay till the end of the video, where I'll provide you with information on how to become a certified marketable medical coder. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. If you are new to this channel, welcome. Feel free to look over our channel, look over our videos. Don't forget to hit the subscribe button and click on the bell for notifications when we post new videos. Also, if you find value in this video or any video on our channel, don't forget to like the video, comment on the video, and if somebody you know can use this information, share the video. Okay, let's get right into our topic. The proposed rule, I just want to focus primarily on why and what's going on. So, as you may or may not know, the medical record is very important. Most of them are now on electronic medical record, but the information contained, the documentation, is really vital and critical to providing patients with quality of care. And the information that the providers document really helps with the reimbursement of the services as well, because it shows the reason why the patient was being seen, the medical necessity, and what types of services were actually performed. And based on that information, payment is then derived. The medical records also provide what's been going on with the patient from X amount of time to the present. And it helps the medical community and all the providers know how to take care of the patient, how to treat the patient, what has been done, what has been tried, what worked, what hasn't, and if there are other things that need to be tried. So it's really important. Documentation is really important for a multitude of reasons, but one, of course, is reimbursement, and that's what we're going to talk a little bit about today. So our typical office visits, and that's what we're going to focus on because that's what the proposed rule was about. Pretty much you would base these services on three different things. The patient type, so if it's a new patient or an established patient, the setting of the service, so whether this was an outpatient setting, an inpatient setting, a nursing facility, home care, etc. And then the level of the evaluation and management service performed. So the levels are based on three key components, and I have a video that talks pretty much in detail about evaluation and management services and leveling. I'll post that in the link below, and maybe you'll see it somewhere here flashing. But there are three key components to an evaluation and management service, and they are the history, the exam, and medical decision making. So what is proposed from OPPS for the office and outpatient E&M visits is to make it a single payment rate for visit levels 2 through 5. And then they're also proposing to go along with that a minimum documentation standard. At a minimum, the documentation that's required for a level 2 would pretty much cover the provider for the payment that is received in that combined level. There's a lot of buzz related to this. A lot of providers feel like, especially specialists, it appears on the surface that they're going to be shorted. If you are a provider, or you know a provider or work for a provider that generally codes on the higher spectrum, so if they usually code levels 4s and 5s, then they're probably going to hit be hit the most. If you are working for a provider, or you are a provider that codes primarily on the lower end of the spectrum, the 2s or 3s, then it's going to be advantageous for you. And if you're in the middle of that bell curve, you know, that bell curve that all providers should fall in, and so if you're in the middle, then you pretty much, I guess, don't necessarily get a monetary gain or loss, but a reduction in documentation, because really you only have to document up to a level 2 service. And then the other piece is to allow providers to document, well, they've always had the choice of documenting under the 95 guidelines or the 97 guidelines. Again, I won't go into that in this video, but if you follow evaluation and management, you know all about those guidelines. But they can also use medical decision making or time as the basis to determine the level of evaluation and management service. This is sort of the piece that is going to help, supposedly, the specialist when documenting their services, because again, they can just place the time and it reduces the burden of having to document all of the key components, the history, the exam, the medical decision making. So more to come on that. In a previous video, I mentioned what those proposed payments look like. So for a level 1 established patient, you're looking at a $24 payment. For the combined levels, level 2 through 5, you're looking at a proposed payment of $93. Again, loss if you are generally coding levels 4 and 5. Gain if you're, generally coding levels 2 and 3. For a new patient, you're looking at, for level 1, a proposed payment of $44. And levels 2 through 5 combined, you're looking at a proposed payment of $135. Again, so much buzz is around this, and one thing that they want to do is kind of a way to sort of help the specialists. So they're proposing a new HCPCS code. It's GCG0X. And it's visit complexity inherent to evaluation and management associated with endocrinology, rheumatology, hematology, oncology, urology, neurology, obstetrics and gynecology, allergy and immunology, otolaryngology, cardiology, or interventional pain management centered care. And so this will be an add-on code that you would add on in addition to the evaluation and management service. And so this add-on code will help with the additional resource costs that specialties provide, especially if, most of their services are reported at levels 4 and 5. So this is a way that is supposed to assist them. And so they would code this in addition to the level of service that they are actually coding. So again, more to come. Comments are coming in. Folks are very passionate about this, so we'll definitely wait on the final rule to find out. If you are passionate about this and want to comment, you have until September the 10th to comment on this particular proposal. I'm a little on the fence. I see where it could potentially help with the documentation burden, but as an auditor, compliance professional, and coder, it's a little, how can I say, it's going to be interesting because, we sort of look for specific components related to these evaluation and management services to be able to say, yes, this justifies the service or not. So being able to help our providers and provide the appropriate education initially is going to be a little hard until, it's all ironed out and there's a clear understanding of what is expected. And usually CMS will put their proposal out or put the final rule out, and then other insurance companies will follow suit. So more to come on that. But I just wanted to provide you just a little more detail related to some of the proposed changes on evaluation and management service. Stay tuned for our next video where I'll talk a little bit about the other buzz, and that is related to evaluation and management services with a procedure where the 25 modifier is used. So again, thank you for watching. If you're not part of our community and haven't hit that subscribe button, what are you waiting for? Hit that button and be a part of our community. Also, don't forget to hit the bell for notifications. Well, hopefully this was helpful for you. If so, feel free to place a comment in the comment section. Click that like button and again, share the information with your colleagues and friends. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder, reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care.
Are you interested in medical coding, but not sure where to start, and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.